Hello everyone. So today we are going to discuss regarding this pathogenesis of syphilis, which is a sexually transmitted disease which is caused by a gram-negative bacteria called Treponema pallidum, which is also known as a spirochete. And there are three major modes of syphilis transmission. So one is person to person via vaginal, anal, or oral sex through direct contact with a syphilis canker, and person to person during foreplay even when there is a no penetrative sex, and from a pregnant mother to a fetus, so if the pregnant mother is getting suffered from syphilis. And Treponema pallidum, this spirochete was identified by Schauden and Hoffman in 1905 in cankers and in inguinal lymph nodes of the patients who are getting suffered from syphilis symptoms. And we already discussed regarding these transmission. So sexual route is one of the most common route of transmission, which is followed by materno-fetal route, and even we can also observe the transmission through blood. And if you observe the spirochete, it is a spiral shaped coiled bacteria, and it is very lengthy in nature. And if you see these spirochetes, so generally these spirochetes are long, slender, helically and tightly coiled bacteria which are gram-negative in nature. So they are both aerobic, so that means they can survive both in aerobic as well as anaerobic environment. And the motility is nothing but corkscrew motility will be there, and it's a free living one, or it can also act as a parasite. And the best known diseases which were caused by these spirochetes are nothing but specific syphilis and Lyme's disease. And coming to our Treponema pallidum, it's a spirochete which is having a spirals of 4 to 14 and with a length of 5 to 20 microns, and it is very thin in nature. So the width is 0.5 to 0.1 to 0.5 microns, and so it can be observed in dark field microscope or fluorescent antibody techniques. And so if you observe this spirochete under dark field microscope, it will be observed like this. And so whenever if you observe, if you collect the fluid from the canker, and if you observe it on microscope, so we can observe the spirochete like this. The spiral shaped bacteria is nothing but our Treponema pallidum, and the movement of this Treponema pallidum is possible with these axial filaments. These axial filaments are nothing but so that means flagella. So all other bacteria will have flagella for their movement, and our Treponema pallidum will have axial filaments. So this will help these axial filaments enable the movement of the bacterium by rotating in the place. Coming to different forms of syphilis, we have two different forms of syphilis. One is congenital syphilis and acquired syphilis. So if syphilis is caused by materno-fetal route, we will call it as congenital syphilis. And again, based on so that means based on the onset of this development of syphilis, we can classify this congenital syphilis into two types. One is early syphilis and the second one is late syphilis. So early syphilis, whenever if you observe it less than 2 years of age in that child, so we will call it as early syphilis. After that, we will call it as late syphilis. And coming to acquired syphilis, if an individual is developed with syphilis because of sexual transmission or blood transfusion, we will call it as acquired syphilis. And again, it can be classified as early and late syphilis. So in early syphilis, the subclassification is primary syphilis, secondary syphilis, early latent syphilis, and in late syphilis we can see tertiary syphilis, where we will observe neurological complications, cardiovascular complications, gummatous lesions, and latent syphilis. So if you see the primary syphilis during the incubation, so actually the incubation period of this Treponema pallidum is 9 to 19 days, which usually ranges and an average in approximately 21 days will be there. So this canker is developed at the site of contact or inoculation, which multiplies at the site of entry. A small painless primary lesion called canker is formed during this primary syphilis. So this canker appears both on extragenitals and as well as genitals. It will be observed in penile region, vaginal walls, also occurs in cervix, perianal area, mouth and anal canal. And so it possesses a hard ridge, very thick hard ridge will be there. So with a glary exudate ridge, so spirochetes will come out of that canker, and serological tests are positive in 80% of the individuals at this stage. And in this picture we can see that canker development in penile region as well as vaginal region and even on the tongue. So both we will observe in extragenital as well as genital regions. Coming to secondary syphilis, that means this syphilis, secondary syphilis is observed after 2 to 10 weeks after primary syphilis, and the symptoms which we observe is nothing but fever, headache and skin pustules. These are all the common symptoms which are observed, and all these symptoms will get disappear even without treatment. And along with these three symptoms, we will also observe anorexia, malaise, weight loss, nausea and vomiting, sore throat and slight fever will be there, and we'll also observe temporary alopecia and brittle nails. So and next one is latent syphilis. So after several weeks after secondary lesions disappear, disease will become latent. That means where the individual will become non-infectious and we won't observe any symptoms of this syphilis there. So it's a non-infectious stage except for transmission from mother to fetus. Tertiary syphilis, if you see this tertiary syphilis, it develops after many years in person with untreated secondary syphilis. If the individual who is getting suffered from syphilis, whenever he enters into stage 2, that means secondary syphilis, and he is not treated, then so he will enter into a stage of latency, and after several years we will observe this tertiary syphilis, which is characterized by formation of gummas in skin, bone as well as nervous system. And so most common complications which are observed is nothing but we will observe gummata as well as gummatous lesions in various organ systems, and so those gummatas are nothing but rubbery tumor like lesions are observed, and along with that we will also observe some complications such as bone deformities, blindness, loss of coordination, paralysis. And these are all the different treponemial as well as non-treponemial serological tests which are used to diagnose syphilis. Thank you.